health. To begin today's briefing, we will open with remarks from Dr. Shah, who we would also like to thank for his last year of service, as today is his one-year anniversary with the Department of Health. Dr. Shah?
Thanks, Julie. Can you hear me okay?
Yes, I can hear and see you. Great.
Well, apologies, everybody. I've been having a little bit of technical issue with, as you saw, with my camera for the last few minutes. So a year into this, still having tech issues. So I think that has not changed. So I think maybe that theme continues throughout. But I want to, first of all, just thank you, Julie, for the 1 year shout out. And it has been an incredible journey this 1 year. So much that all of us have to be proud of when it comes to our efforts against this pandemic and in really raising the visibility of public health and the partners and the work that they are doing on the ground every single day. So I just want to start by saying thank you to everyone for what you have all meant to us as we continue to move forward in fighting this pandemic, a pandemic that continues and has more twists and turns than freeways and roads that all of us have traversed over our lifetimes. So this is another reminder that we may be tired of this virus, but this virus is not tired of us. I want to thank our media partners for your attendance today. I know a lot of you have been concerned about what's happening related to Omicron and what's happening in our state. And we're going to try to break that down for you as best we can. There is a lot of really good information related to not necessarily Omicron in particular, because there remains concerning news related to Omicron globally and as well across the country and in our state. But I do think it's important for us to be thinking about very much what are the tools that we have in our toolbox. So when I look back and think back a year ago, the vaccines had just arrived in the state of Washington, and many of the tools that we had were simply just wearing masks and trying to avoid others. And now we have vaccines. We have not just vaccines for adults, we have vaccines for 5 years of age and up. And we also have the promise and the benefit of boosters. And one of our key messages today is going to be about boosters. Whether it's Delta surge that we have in our state currently, whether it's Omicron that we're starting to see take hold in our state as well. The key is that there are things that all of us can do. One is to get vaccinated, and the other is to get our booster. And then the other is to make sure that we're following safety protocols and just thinking through how we can live safely and be careful around others. I think that is the key message for us today. So why don't we go ahead and get started? As CDC announced yesterday, the Omicron variant is now the prominent variant in the United States. We are watching this very closely. Obviously, the concern is all the unfolding information related to what is the transmissibility of Omicron, what's the severity of Omicron, how effective are vaccines against Omicron, and a lot of information that remains still to be told or to be gotten. And what we are doing is to process all that information globally and nationally, and also looking at what's happening here statewide. Statewide, we are not seeing the Omicron prevalence take over Delta yet, but Dr. Lindquist is going to talk about that in context so everybody recognizes the importance of what we are seeing with Omicron in our state. However, we have to remember that as we continue to look at what's happening across the state, our early surveillance from a lab standpoint was very much related to detecting Omicron in our state and then having a better view of where it was in our state. And that means that we also have to now shift to doing more representative sampling across the entire state so we can get a better picture of how and where it is spreading. What's important now is not just the numbers, but also very important is the severity of illness related to Omicron. Obviously, we are very concerned about outbreaks that we have been working with our partners on in wrestling tournaments, especially across the state of Washington. And we want to do everything we can to continue to keep our healthcare system strong and protected, as well as keeping hospitalizations down. Our healthcare system is absolutely stretched and strained right now. Many of our providers are being pushed in ways that they have never been pushed in their entirety of their careers. And that means that it has been really challenging, whether you go to the largest of large hospitals or healthcare system or clinics in the state of Washington, or you go to the smallest of small. It's a similar theme that the staffing and the real challenges for staffing has been a significant concern for all of us. And we're doing everything we can as a state to be able to support our healthcare system. We are concerned that with Delta surge, that hospitalizations have started to and have continued to come down. But our concern is to watch what's happening with Omicron. By and large, thus far, the information is such that it appears that hospitalizations are not as much related to Omicron, but I want to caution everybody that it is too early to pronounce that as a done deal. Omicron, when it's got increased transmissibility compared to the Delta variant, the concern is that some proportion of those individuals are going to be hospitalized, and our concern is that our system is already strained, and what will happen if hospitalizations spike again or increase to a level, especially at a time of staffing constraints. That's a real challenge and a real concern for all of us. Julie, if you could pull that slide back up, I do want to focus on the importance of vaccinations. This is a message that we have said for months on months. In fact, I would dare say we've said now for at least a year that vaccinations work. They're safe, they're effective. And this shows you that hospitalization rates in the state of Washington in November very much track with those who are vaccinated are less likely, markedly less likely to be hospitalized in all age categories compared to those who are unvaccinated. And so we want to make sure that people recognize that while we're hearing news about Omicron, you're seeing what's happening in the hospital system, and you're saying, well, what can I do? Well, we know what you can do is first and foremost is to get vaccinated if you have not gotten vaccinated. But the key measure is that and if we could show the next slide for vaccines. Next slide. The numbers for the vaccines. So as of just a couple of days ago, we have administered more than 11.5 million doses of COVID vaccine across the state of Washington. And that means 5.5 million people. And what I want to make sure people recognize here is that that is amazing. That's one of the top states when it comes to vaccinations across the country. However, it is so critical now that people get boosters. A good portion of the people who are in the categories that's right on the slide here, the 11.5 million plus doses that have been administered, the 5.5 million plus people who have been vaccinated, we are going to ask you to come back if you're eligible and get vaccinated yet again. What that means is get your booster immediately if you are over the age of 16 and eligible, meaning 6 months past your Moderna or Pfizer vaccine or 2 months past your J&J vaccine. And also children over 5 should start their 2-dose vaccine series immediately. Why is this so critical? It is critical because of what we just showed, that vaccines work, they're safe, they're effective, but we also know that we have waning immunity, that over time, those vaccines will need to get boosted. And the evidence is clear that we need to get this additional booster shot. We want to do everything we can to emphasize that message. please get your booster immediately, as quickly as you can. Now, that said, we also recognize that it's in many places across the state of Washington challenging and difficult to get your boosters. Those appointments are hard to come by. So a few things for the public. First and foremost, if you're holding multiple vaccine appointments, please cancel them, especially if you know that you are now going to go to a certain site and you're going to get your booster. Please cancel your other appointments. Number two, do not wait for the perfect booster. If you can get Moderna or Pfizer, the best booster is the one that's being offered to you. So do not try to get the perfect booster, Moderna or Pfizer, that whichever booster vaccine is being offered at the clinic that you are going to or the site that you are going to, please get that booster. However, we're also very concerned about vaccine appointment availability. The governor has directed us at Department of Health to work with our partners to look at vaccine capacity as well as take aggressive steps to increase that capacity across the system. We are doing just that in terms of our planning and our work behind the scenes, and there will be an additional information that's going to come out over the next few days. But what the key message is that the governor and his team and our team are working together, and he has directed us to improve the vaccine appointment process in terms of availability of those appointments for people. And we are committed to getting boosters to Washingtonians across Washington. So in other words, when we say get your booster and then you try to go online or you try to make a phone call and you can't get your booster, you're frustrated. We know that. And we're doing everything we can to alleviate that and improve that system. We also recognize that there has been an increase in demand for boosters, especially around the holidays and people gathering, and especially as people are traveling. That said, that's a good thing. We want to see an increase in people excited about and interested in getting boosters. And that's something we are going to continue to support. That's the message. We want to continue to support that message and also take those actions to be able to increase that capacity. If I could show that other slide now of what else we can do as we get into the holidays and the winter time. This is a really important point of information. I hope that our media partners will be able to show this. It is not new information necessarily, but it is absolutely critical that we all take the steps that we can to protect ourselves. That means getting vaccinated first and foremost. And what that means is if you have not started your vaccine, please start your vaccine as quickly as you can. And if you have already gotten vaccinated, please get your booster shot, as I mentioned over the last few minutes. Wear your mask, watch your distance, wash your hands, be careful in crowds, be careful indoors. There are some very important messages. These are what we call safety protocols. These are how do you take and empower yourself with the ability to do things so that you can be safe and protected. There's so much we don't know about Omicron, but there's so much we absolutely know about Delta, which is all of these very simple but important actions are what are going to help all of us as we move forward in this holiday season. And we especially want you to be careful and utilize these actions as you are considering traveling, or if you're about to travel, to make sure that you're also aware of what's happening in the destination that you're going into, whether across the US or whether it's in a global setting. The last message here is stay home. If you are sick, get tested, and we are doing everything we can. We're very appreciative of the president's announcement today about the importance of and the ability of the federal government to be able to get at-home testing for all Americans or most Americans or Americans who are interested in getting the tests at home. We think this is an important strategy that is absolutely key for people to be able to protect themselves and their loved ones, not just during the holidays, but beyond. And so, again, one of the biggest issues that we have is just the manufacturing capability for the at-home tests are just not there yet. So we're really hopeful with the president's announcement that we're going to start to see an increase in at-home testing availability, that capacity across the country, and also here in the state of Washington. A reminder to everybody is that if you feel that you are concerned, as we all are, about what's happening from it's getting you down, it's getting you depressed, you're anxious, we want to make sure that you're also taking time to take a breather from all the news that's out there, doing your best to take a break from those things, that you're getting good sleep, that you're taking your vitamins, that you're doing everything you can to be healthy, both physically and from a mental health standpoint. And if that means a spiritual standpoint, a behavioral health standpoint, or as I mentioned, a physical health standpoint, please focus on those things as well. And we want to do everything we can to be supportive. And we have additional information you can get on our DOH website. We also have our 833 VaxHelp for appointments. There's also information about mental and behavioral health resources. But the holidays are a very difficult time for everybody, the stress and the strain. But this year it's particularly concerning because all of us thought, and we're hopeful, that by this December, we weren't going to have a new variant, or we weren't going to have an increase in concern or cases. And that is not the case. And so we've got to do everything we can to support each other. So check on a neighbor, check on a family member, help them get a vaccine appointment, help them to a booster appointment, drive them over there, do something to help someone, a neighbor, a friend, someone who you don't even know, help them through this difficult time, and we will get through this together. So I'm excited about completing the 1 year. Today is that 1 year. I'm also very excited about what's coming in the year to come. And I am very much mindful that we've got some challenging times ahead of us. Get boosted. We're going to do everything we can as a state to be able to help you get your booster shot. It's going to also be really critical that people continue to take the actions that they can take to help protect themselves. And that includes all the things that we talked about. So with that, thank you so much. I'm going to now turn it over to Dr. Lindquist, who's going to talk about the data, the information related to Omicron, and also what we're seeing across with cases and hospitalizations in the state of Washington. Scott.
Hey, thank you. And appreciate that first year, Dr. Shah. Thank you. It was a very hard time to come in and take over an agency during a pandemic, but thank you for sticking in there, and we're all behind you. So I want to talk about the case counts first. So if we could have the first slides here. So we all know this. We know we're in this fifth wave. It's coming down, and we're seeing some bumps in it. So I don't think we are out of the woods yet on this fifth wave, as we are introduced with two things that I'm very concerned about. One, the Omicron variant is becoming more and more the prevalent variant, and we'll talk a bit more about this in a sec. And I am just being alerted by our surveillance staff that we are starting to see the first cases of influenza A in the state. And so this is going to be a really unfortunate season where we have a new variant, Omicron, and we have flu appearing in the community at the same time, while our case counts are still pretty high. Our hospital systems are stretched. So let's go on to the next slide. This actually shows hospitalization counts. They are as high as some of the other previous still. It's not all entirely due to COVID. There is some over boarding in hospitals right now due to a typical winter rush. This again sets the stage for a very difficult winter where we're going to have flu now appearing, a new variant appearing, and hospital capacity is going to be limited, especially during the holiday season, while we have an exhausted workforce that has been doing COVID hospitalizations for 2 years now almost. So next slide. And this really looks at case counts versus the hospitalization counts. It really makes the point that these follow almost verbatim. What tends to lag is death counts. And I'm happy to say that our death counts remain fairly low. What we had today reported were 34 deaths, and that is compared to almost doubling of that previously during this large fifth wave. So again, and you heard Dr. Shah say it's way too early to predict, will Omicron cause excess hospitalization, excess death? This is really the point of what the state should be doing. We need to have a good, solid surveillance system, watching our case counts as Omicron becomes more and more prevalent, watching our hospitalization effect as Omicron becomes more and more prevalent and flu is here, and then watching our deaths to see. We're getting preliminary data, nothing that I feel comfortable predicting on yet, that this Omicron variant is not associated with as much death, hospitalization, or severe disease, but that remains to be seen as we watch this surveillance in Washington state. Now, having said that, Omicron is clearly here. As Dr. Shah said, our main goal was to really look hard to see, was it even present in the state? And so we did very aggressive, very skewed sampling to see if we could find it. And we indeed have found it. Our Omicron cases that have been reported to me this morning are 400. 400 are associated with the Omicron of all the genotyping that we have done. Now, we're a very aggressive genotyping state, so that's not surprising the number is high. And so as Dr. Shah said, we are now shifting the gears. It's not just about counting Omicron cases. It's about sampling the entire state. That's Eastern Washington, Western Washington, North, South, rural, urban, to see what is the prevalence of Omicron versus Delta and how fast does that unfold. So that is what we are really unfolding. I am incredibly comfortable with that infrastructure. We are one of the leading states for doing this genotyping, but that allows for some confusing messages that are coming out. We are hearing on the very leading edge, so high-risk patients, high-risk counties for Omicron are seeing upwards of 70% of their samples are coming back as Omicron. That does not represent the state, and it does not represent anything other than really the leading edge of this infection. We still have quite a bit of Delta in the state, and our surveillance system is really picking up everywhere in Washington as a representative sample. So we will have better idea of how fast Omicron is unfolding. It appears to be very quick, as we have seen globally, and our surveillance system is now starting to pick that up too. Leading edge, though, is very different than representing the entire state. And with that, I just want to leave you with the fact that we are indeed seeing a preliminary increase in cases in those 14 to 19 for a very specific reason. We are having a very large outbreak in wrestling-associated tournaments where both students, refs, coaches, and people that attended these events are being diagnosed with COVID. And we know that Omicron is one of the variants that is in these. And as of this morning, we have over 350 cases associated with wrestling. This is going to be a very large outbreak. And again, I will end with this, reminding you all the things that Dr. Shah told us about, really being smart about going to events like this, wearing a mask, making sure you've optimized your vaccination with a booster, with even getting vaccinated, and be very careful about being in these crowded spaces. These are what are going to bring on these outbreaks of Omicron in the state, as we're seeing with wrestling. So with that, I turn it back to you, Julie.
Thank you, Dr. Lindquist. We go now to Sheann. Go ahead.
Excellent. Good morning. I'm Sheann Allen. I'm the COVID vaccine director for the Department of Health. Our friend Michelle Roberts is taking some time off for the holidays. So first, I wanted to start by updating you on our vaccine numbers. And if you could pull up the slide, please. There we go. More than 82% of people 12 and older have received at least one dose. And you can see more than 75% of that age group have completed their primary vaccination series. Across the state, we've given out more than 11.6 million doses of vaccine over the past year to more than 5.5 million people. Let's keep that energy going and get even more of our friends, family, and community members vaccinated, boosted, and protected from the worst outcomes of this disease as we head into the new year. So speaking of boosters, as Dr. Shah said, we recommend everyone 16 and older get a booster shot as soon as they are eligible, which is 6 months after completing the Pfizer and Moderna primary vaccination series, or 2 months after getting the single shot of Johnson & Johnson or J&J vaccine. We know COVID-19 vaccination is effective at preventing severe disease, hospitalization, and death, but effectiveness does decrease over time, which is normal for vaccines. The recent emergence of Omicron variant further emphasizes the importance of vaccination and boosters. Both Moderna and Pfizer recently released information for preliminary lab studies, which found that their booster dose likely offers protection against Omicron strains. We expect more information to be shared from the manufacturers. So far, nearly 1.7 million people across Washington have received an additional dose, which is a combination of boosters and third dose. So there's much more work to do regarding boosters. Also in the recent news, Pfizer shared new information on the ultra-low COVID-19 vaccine for even younger kids. Although the company says the vaccine appears safe for 2 to 4-year-olds, early studies show the 3 microgram shot may not provide enough protection. So Pfizer is now seeking approval for a third dose for that young age group. As of right now, we don't have a timeline for the next steps, but we'll share information out as it becomes available. But there is good news. More and more kids 5 to 11 are getting their Pfizer pediatric vaccine each day. More than 172 kids have received at least 1 dose, which is 25% of this younger age group. Last but not least, I want to talk about the updated vaccination recommendations that Department of Health released on Friday. Following guidance from the CDC's Advisory Committee on Immunization Practices and the Western State Scientific Safety Review Work Group, DOH is recommending people 18 and older choose to receive either Pfizer or Moderna over the J&J vaccine. The update comes from new data about TTS, which is a rare but serious condition involving blood clots and low blood platelet counts seen in people who receive J&J. Across Washington, about 436,000 doses of Johnson & Johnson or J&J have been given out, which is about 4% of the total doses administered across our state. J&J will still be an option for those who are not able to receive an mRNA vaccine. If people have any questions or concerns, we ask them to talk with their trusted healthcare provider about their options. With new variants like Omicron, vaccination, both primary series and booster, are more important than ever for everyone 5 and older. To find locations near you, visit the state vaccine locator website or vaccines.gov. And if you have questions or need help, please call the state's COVID-19 hotline at 833-VAX-HELP. Again, like Dr. Lindquist mentioned, this time of year, it's not just COVID-19 as the only illness that's circulating, it's also flu season. Remember, you can get your COVID-19 vaccine on the same day as you get your other vaccines, like your annual flu shot. We recommend a flu shot for everyone 6 months and older. Thank you, and I hope 2022 brings lots of happiness for all.
Thank you, Xian. And our final panelist is Dr. Kwon Get. Go ahead.
Thank you, Julie. I just wanted to reinforce some of the messages that have already been given around childhood vaccination and hospital capacity. So it's so important that we continue to get as many children age 5 and older vaccinated against COVID-19 as soon as possible. As we know, COVID-19 in children can be a serious and sometimes fatal disease. In our state, over 1,000 children have been hospitalized and more than a dozen have lost their lives to COVID-19. And children with chronic conditions are especially at risk for severe disease. So we really need to get kids started on vaccination and current on vaccination for children also means getting boosters for those who are eligible. And so we're fortunate that now teenagers 16 years and older are eligible for a booster vaccine, which can powerfully increase their protection against the Omicron variant. It's also important to remember that vaccinating children not only protects them, it also helps protect the most vulnerable in our community. Vaccinating children can be an important way of protecting their grandparents, their aunts, their uncles, their parents, even siblings, other members of their family who are at higher risk of hospitalization and death from COVID-19, either because of age or chronic conditions. And that's really one of our most important goals, decreasing hospitalization and death from COVID-19. And to do that, all of us have a part to play. The more people we can keep out of the hospital, the more people we can keep alive. Our hospitals are highly stressed, not only because of COVID-19, but also because workforce shortages throughout the healthcare system are making it difficult for them to discharge patients without COVID-19 from the hospital. Even those patients who are well enough to get discharged to other facilities, such as long-term care facilities, are in the hospital because there's nowhere for them to get discharged. And when our hospitals get stressed, it's not only people admitted for COVID-19 at risk, it's all people requiring hospital care for any reason who are at risk. And this comes at a dangerous time because even before the pandemic, we saw seasonal surges in hospitalization from influenza and other respiratory viruses. And even before the advent of Omicron, our modeling projections were warning of the potential that our hospitals could be in for a very difficult winter. And now with a highly transmissible variant like Omicron, we are very, very concerned about hospital capacity. So all of us need to do everything we can do to keep people out of the hospital. And the most important thing is to get vaccinated and to get boosted. So thanks, and back to you, Julie.
Thank you so much, Dr. Kwanget. Since we started a little bit late, we will be going over 11 a.m. till 11:15 at least. We have 7 reporters in the queue right now, and we will begin with Ariel from the Spokesman Review. Go ahead.
Great, thank you. I have 2 questions this morning. First, looking at other countries and preliminary data coming out about Omicron, do you expect Omicron to lead to more hospitalizations in Eastern Washington and less